Hello, Gloria.
Hi, doctor.
Thanks for coming in today. I understand you're here to review your blood pressure readings over the last couple of months. Is that correct?
Yep.
Good. Is there anything else that you'd like to discuss or go over today?
Well, I really don't want to go on any more blood pressure, any more medications at all.
Okay. Anything else?
No, that's it.
Okay, so we're going to review your blood pressures since the last time you were here. And I understand that you're really not that keen on going on additional medications at this point. So we'll discuss that and keep that in mind.
Okay.
Okay. So since the last visit, how have things gone?
Well, I've been really diligent, doctor. I've done everything that you asked me to do. I went to see the dietitian, and I went to get my blood pressure checked in the community. I bought myself a blood pressure cuff. I've been taking the readings, like you said. I'm following the dietitian's plans for eating right and cutting back salt, and I'm walking my black lab way longer every day.
So you're doing a lot of things.
Yeah.
Seems like you're a little upset about that.
Yeah. Well, look at my readings. I think I remember what you told me. I'm doing everything right, and this is kind of bothering me.
Okay. Well, you sound a little bit annoyed about this, but we'll have a look at these readings. But I think it's important to recognize that all of the things that you've done are very positive and certainly will go a long ways towards improving your health, regardless of the effect on your blood pressure. So let's have a look at your readings. Probably, as we discussed last time, we'd like to see your readings because of your diabetes somewhere in the 130/80 range or below. That would be ideal to minimize any of the risks. If we look at most of the readings here, quite a significant number of them seem to be above that range. And so that's always a little bit of concern in terms of trying to keep those risks for your diabetes as low as we can. Do you have any thoughts about that?
Well, I feel fine. I was kind of hoping they'd be close enough and I wouldn't have to go on medication.
Sure, yeah, and that's always the goal. Unfortunately, sometimes, despite your good intentions and your good efforts and working at all of the things that we've talked about and that you've mentioned, sometimes it's just not enough to get the readings where they should be. Sometimes there's genetic factors and other things that play a role. So really, if we want to try and keep those risks of things like strokes and kidney disease and heart disease to a minimum, we really should try and control these a bit better.
Oh yeah, my mom had a stroke.
Yes, I recall your mom had a stroke when she was about 70 or so. Yeah. So those are the kinds of things that we'd try and keep the risks as low as possible by controlling this the best way we can. And all of the things you've done are certainly helpful in that regard, but trying to get the blood pressure lower would be ideal. So normally, when you've made all of the good efforts that you've made and the readings aren't quite where we'd like them to be, usually we need to consider some medication to try and lower that.
Well, I don't exactly want to get a stroke.
Yeah, and that's certainly the goal, is to try and keep those risks as low as possible. So normally under these circumstances, particularly with your diabetes, we'd recommend starting on some medication to see if we can get those numbers into that range that we talked about. And normally we'd use a type of medication called an ACE inhibitor, which is a type of medication that both lowers the blood pressure but also tries to reduce the risk of kidney disease, especially in people with diabetes. So that's what I would recommend we consider starting you on. It's a medication that's easy to take. It's just taken once a day. It's generally pretty well tolerated. Some people might get a little bit of a dry, irritating cough, tickle in the back of their throat, and in those cases we may need to change the medication. But otherwise, most people tolerate it pretty well. Do you have any thoughts about that?
Well, it sounds like it sounds like I should take another medication. It's only once a day.
It's once a day, yes. And hopefully it'll be enough to get the blood pressure in the range that we'd like. And if not, then we'll reevaluate that and see where we need to go from there. It's certainly important to keep all of those lifestyle changes that you've made going, because those are important in reducing your risks. And sometimes it does help in reducing the amount of medication we might need to use in terms of controlling the blood pressure. So that's always an advantage.
Oh, okay, so I should keep monitoring?
Yes, so what I'd like you to do, if we start the medication today, is I'd like you to continue taking the blood pressure readings nicely as you've done, and thanks very much for doing that, twice a day, 3 or 4 times a week, and keep a nice record as you have here. And then I'd like to see you again in a month so that we can review those readings and see how we've come along. If in the meantime you think the medication's causing you any trouble, you get that annoying dry tickling cough that you can't attribute to something else, or certainly if you're feeling faint or lightheaded, particularly when you're getting up from a lying position, then certainly you should come and see us sooner.
Okay.
Now, is that something you think you'll be able to do, is to take the medication and continue to monitor the blood pressure?
Yeah, when I came in, I was quite irritated, and I didn't want to go on blood pressure, and I think it sounds like it's a really good idea for me.
Yeah,
Thank you,
I
Doctor.
think it's really the best thing to do at this point.
Thank you.
Okay, good. So we'll get that prescription for you, and we'll see you again in a month.
Okay,
Excellent. Thank you.
very good.